the ankle draw test is used when somebody comes in saying that they twisted their ankle badly and it's swollen up, and you're suspecting a sprain, a lateral ankle sprain, exactly right. So they will have given you a history where something happened. They fell off a curb, they were playing basketball and landed awkwardly and their foot went under them. And you will have a very distinct history, so that's the listening skills that we said right at the beginning, that will think, okay, it's hurting there, they're telling me something happened, I'm going to do this test. So then we've got to think about the structure that we're testing. In an ankle sprain, there's 3 lateral ankle ligaments that you will be reminding yourself of, I'm sure, subconsciously right now. And they go in order of 1, 2, 3. They don't generally go all together. The first one to go is the anterior talofibular ligament, the ATFL, as I've written up there. The second one to go, so if it was a really nasty sprain, would be the calcaneofibular ligament. So it's normally that one that goes first, then that one, and then if you really rip your foot off the end of your leg, it's a really nasty injury, and there's normally car crash involved or something like very, very traumatic, high forces. Then you start disrupting ligaments inside as well. So you come in, you've told me that you had an incident. I'm going to get you just to bend your knee up for me, because what we need to do is put this ligament in the line of tension so that we can test to see if it's doing its job. Remember, ligaments are the things that join bone to bone and keep the joints stable, and they guide movement, the direction of movement. So if it's not doing its job properly, I can test it by pulling on it. I'm stabilising the tibia, pulling the foot down into plantar flexion, and just drawing the heel towards me. It's why it's called the draw test. It's like opening a drawer. And what I'm doing is I'm feeling for a certain number of things. I'm feeling for the extent of movement, and I'm feeling for the end feel as well. And a third thing that you can look for is what's called a suction sign, whereas if it's really gone, the joint creates a vacuum and sucks the skin in, so you get a little suck sign just there, a little dent. But how do I know what's normal for my patient?
Test the other foot.
Test the other foot. So I'm going to come first of all to the one that isn't damaged. Firstly, so the patient knows what to expect and doesn't try and kick me when I go to the one that hurts, but also to find out what feels normal for that patient. So you might have somebody who's got hypermobility, so a little bit more give is normal for them. So that's the ankle draw test. A positive test would be when there's no firm end feel. Do you remember your end feel? So a spongy end feel is like your muscle and your tendon, and a sort of snapping rope feel is your ligament and capsule end feel. I want to feel that ropey end feel. And I want it to have the same extent as the good side as well. Usually, actually, that test isn't painful, believe it or not, for most people who haven't damaged other structures as well during their tests.